So, hello, Dr. Shanti. How are
Hello,
you?
madam.
Many
Yeah, I am
congratulations
very.
from my side
Thank you so much.
on this incredible achievement.
Thank you so much, madam.
Okay, how are
It
you
is all
feeling?
because of you only, ma'am. I can definitely 100% say, yeah.
How are you feeling?
I am feeling very happy.
Yes.
After long years, I am going to work now, so I am very much
Ah,
elated.
yeah, that's really nice. Really nice.
Yes,
And I'm so happy for you because I know it was a very long journey for you. Very
yes,
long
ma'am.
journey. Yeah. So can you share like how you started and how you prepared for this exam?
So I finished my MRCOG Part 2 in 2018, madam, in January.
Okay.
After that, I attempted once the part 3 exam. So in that exam, I got 54. So I doesn't know how to attend and all. I just went and attended because I want to finish that part also.
Yes.
Um, then after that I failed, and then because of my personal issues, I have to quit my studies for
Yes.
almost 3 years. And after 3 years, I opened my book and everything was new. All the guidelines have changed,
Mm-hmm.
and so I have to again read every guidelines again. And then
Right.
after that, I attempted again second time. So when I was find everything was like a Greek and Latin, and I couldn't finish the station at all in 10 minutes,
Mm-hmm.
because I have some household chores and I had baby and I couldn't
Yes.
finish.
Right.
Then 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 I started preparing again with all my courage, and then I came to end by 61. I got 61, and with 1 mark I failed again. So
Mm-hmm.
I lost all hopes then. So this time I was that time I was full of hope that I will be able to pass. Then
Yes.
the role then only I used to listen to all your YouTube videos, madam. It was
Mm-hmm.
very, you speak very calm as well as confident. And every time I go for exam, no, I will be very anxious, and I will not listen to the role player at all. That is my fault. I identified that.
Okay.
And this time I made the role player to talk much and I kept quiet.
Right. Yes. Yes. You have to involve the role player in the stations. Let them give
Yes,
the chance to speak. Yes. Ask their
yes,
concern. Yes. Exactly.
yes. And then the small tips you gave to apologize if it is late. And when the consultant is away, we should ask the role player whether you are happy to continue the consultation with me, like that, a single word that actually
Exactly.
made the role player very calm, I think.
Mm-hmm.
Yes, ma'am.
Yes.
And the other thing is, you just put on red on the any other special concerns you have that I failed to ask in my previous exam. I never asked about any other concern because the here the exam is full of hidden agenda. That
Mm-hmm.
even though the in the outside paper says something else, the patient is taught something else. So,
Okay.
do you
Yes.
have any other concerns? Then the patient was able to come out with what concerns they have. Yes, ma'am.
Exactly. Yes.
Yes. This
And
time I was telling all those tidbits.
mhm.
And then the other thing is, in your course material, no, I found the patient information leaflet was added for almost for many diseases. You have added the patient information leaflet with advantage and disadvantage.
Yes,
Yes,
exactly.
ma'am.
Yeah, because
Yeah.
whenever you're talking about any management, whether it is medical or surgical management, then you have to talk about the pros and cons, advantages and
Yes.
disadvantages. That is the
Yes.
patient safety point. So,
Yes, ma'am.
yeah, patient should know the disadvantages and negative points of treatment.
Yes.
That is very
So
important.
this time I was added everything, this like advantage and disadvantage, and then I waited. As you said, no, you were teaching like you have to ask the patient which method of treatment you want, because they will be trained by the role players will be trained to ask certain treatment from us, I think. So this time I
Right.
asked, what do you want? You want medical or surgical, or what treatment is your wish? And
Mm-hmm.
then I also asked about their background knowledge. If the ectopic is given, I asked whether, what do you know about ectopic? You already know what is your knowledge about ectopic? Like that I asked.
Exactly. Yes, yes. How much the patient knows about the condition. So
Yes, madam.
then if she knows 50% of the condition, then it also makes your life easy. Now you have to give only rest of the 50% of information. Now you don't have to
Yes. Yes, madam.
talk
So
from A
that
to
saves
Z.
time actually.
Exactly, that saves time. And many candidates ask about doing the book task. So what do you say about that?
That is actually, I didn't go through books at all, ma'am. I just went through the what all the stations we discussed. I was
Yes.
repeatedly doing that. Yeah.
Exactly. And many new recalls came, like precocious puberty was there, that new station.
Yes.
Yes.
Those stations, I just told the basic, like, so we have to look for any internal increase where the estrogen secretion comes from. So, what is the cause for that? Like that, I said, whether it can be internal or external, like that, I said.
Mm-hmm.
So,
Yes, yes.
whether the whether the
Exactly.
hypothalamus is secreting or pituitary, basically I answered. And what whether I want to rule out malignancy first, I said.
Mm-hmm.
And then I said, so I will arrange for the hormone studies, as well as in I for the investigation I exactly doesn't know. So as you said, I just
Mm-hmm.
involve the consultant in everything. This is very very rare case for me. So I will
Yes.
discuss with my consultant and do what is needed for the patient.
Yes, yes. So in difficult scenarios, yes, it's always a good idea to involve your colleagues.
Yes, ma'am.
That will complete your communication with colleagues and patient safety as well. Because
Yes, ma'am.
you can't tackle uh, like difficult scenarios alone. Same thing happens in your clinic because
Yes, ma'am.
yes, because then you have to involve the pediatric gynecologist or adolescent gynecologist and all.
Yes.
Yes. And
Then the
yeah.
other tips which you gave is, like, even in extreme prematurity, I said, I doesn't know about all these. So how the baby is salvageable? They asked. I said, exactly. I
Mhm.
doesn't know the figures. I will just involve you, the neonatologist. I will book an appointment with him, so that you
Right.
can discuss, and he will be in a better position to
Yes.
talk about all those. Like,
Exactly. Because even the talk says that you have to involve the neonatologist. Yes, yes. And of course, your consultant.
yes, ma'am.
So I hope you got the benefit from the course.
Yes, ma'am. It's 100% I got it from it. I does
Thank
it
you.
is really a service, ma'am, you're doing.
Thank you. But and it's your hard work as well. I mean that
Yes, ma'am.
perseverance going for the exam and it was your
It is
last
like,
attempt.
what to say, it is like blindfolded, like,
Yeah. You must have been
like,
very anxious. It's very
yes, ma'am.
understandable.
Yes,
Exactly.
ma'am. We want to pass and we want to go for a job here, and then
Yes.
it makes me more anxious, and every time I go, I lose my temper, and I was very
Hmm.
anxious, ma'am. This time I was very calm. I was
Yes.
hearing all your audio,
Mm-hmm.
that is very very helpful for me. I just imitated how you speak. No, I just imitated repeatedly, like.
Yeah, exactly. So this is what I
Calm.
say to everyone. I mean,
Yes,
whenever you're going for the exam, we say be confident. But
yes,
practically there is no confidence. The only thing remains with you is how calm you are there.
yes, ma'am.
So, and I always say, like, you tell yourself that I will be calm and I'm going to tackle any station because like you people have read a lot, you people have like know so many things, so
Yes,
you should know. Yeah, I mean it is like dealing with the stations, it is not
yes,
performing the task. it is like
yes,
it is like really some real life scenario, how you will
correct.
deal with those scenarios
Yes,
in real life.
correct, ma'am.
Exactly. So precious tips from your side to your colleagues who will appear soon in the next exam.
It is only to listen to the role player, and then to follow the first initial part of conversation is very important. Like, apologize whenever it is the patient is waiting for a long time, so that the
Mhm.
role player will be very much comfortable with us. So we
Right.
can, yeah. and then we have to extract whatever information was given to the role player. Maximum we should extract, then only our treatment plan can be told accordingly. And
Mm-hmm.
then we should
Yes.
look for the hidden agendas, ma'am. Outside the board, no, little bit is written, but inside the patient is given more information. So we have to talk with the role player, and then get out of all the hidden agendas. Then
Yes.
only we will pass in applied clinical knowledge as well as the patient safety, I believe, ma'am.
Yes, yes, because this exam is all about communication, how
Yes,
good you are in communicating and in gathering and extracting the information from the patient.
yes,
Yes,
ma'am.
exactly.
And then the other thing is confidentiality. That also you were insisting me. You missed this confidentiality. So I was this time the domestic violence station was there.
Yes,
That examiner was asking. I wanted only one word from your mouth. That what will you ask? What will you ask? I said I will first assure confidentiality, and then I will take the patient separate in a separate room and without the partner, and I will ask what is happening really. Like,
exactly.
yeah, he was
Yes.
very happy with that, ma'am.
Yeah,
Yeah.
because when we were discussing this child sexual abuse station,
Yeah,
even
I
the
forgot.
talk says that
Yes, ma'am.
you have to talk to the child alone,
Yes.
without the child's mother. That is very
Yes.
important. Otherwise, child
Yes.
is not going to give you informations, correct informations. Yeah, same thing applies in domestic
Yes,
violence
ma'am.
cases.
Yes. I forgot when I was presenting that case to you, ma'am. So I
Mhm.
remembered very well that
Yes,
I should.
exactly. Yeah, yeah.
Yes, ma'am.
Because that is why
Again,
we are sitting to give the honest feedback. If you're going to
yes.
forget something, and I
Yes,
stopped you
ma'am.
many times, like even in structured discussion, you used to say Dr. Shanti. I said, no, doctor.
Yes, ma'am.
It has to be
Yes,
only
ma'am.
Shanti.
Yes. This time I could find much of difference with me. So
Mm-hmm.
that confidentiality, I was literally wondering that you
Yes,
insisted me, no, so it reflectly came from my mouth. That the
right.
examiner was asking one word I want from your mouth. I said confidentiality first. I will assure that, like that. He was very happy, ma'am.
Yes. And what about your advice or like regarding going through the guidelines? Because I think recommendations are enough, isn't it? In the
Yes,
last
ma'am. The
one.
block letters which was given the green top guidelines are very
Yeah.
much needed.
Mm-hmm.
Otherwise, the communication skills, the patient information leaflet is very important, I think.
Yes. Because
So your the teaching
yeah,
materials also is
yes,
very good, ma'am. You have compiled all from the NHS hospital. That was very fantastic.
yes,
It
yes,
helped
yes.
me a lot.
Mm-hmm.
It's not
Exactly.
there is no wastage of time, so I can go through all the patient information leaflet within 1 or 2 hours like that. Yeah.
Yeah. So whenever you are preparing a topic, I mean, it should be both reading the recommendation of the
Advice.
guidelines and the patient information leaflet, isn't it?
Yes, madam. Yes,
So,
madam.
yeah. Anything
And
else you want to add? Yes, go on, please.
then the other thing is the incident report. You are insisting me that you should tell the incident report, otherwise you will fail in patient safety. Then the patient was bowel injury patient was repeatedly
Mm-hmm.
asking me why this has happened, why this has happened. Then I
Hmm.
was little bit
Yes,
stumbling. Then I said, yo, that will be instant report will be filed, and our doctors will be investigating your
yes,
case, why it happened, so that it can be prevented. Now, then she kept very quiet. She
yes.
was,
Yeah,
yeah.
yeah. Because you have to explain some of the causes and exact for to know the exact cause.
Yes, ma'am.
This, yeah, the incident team, this your team will be there. I mean,
Yes,
you have to write the incident report. Exactly.
yes, yes, ma'am.
Mm.
And then that the patient, as you said, the patient information leaflet. I have no time to tell all those things, but you were telling that you should we should tell in the first itself. So this time I was following those instruction also.
Mm-hmm.
So I said I will address all your concern, and I will give you the patient information leaflet. The patients were very happy because
Yes.
yeah,
Yes, yes, because like if you have scenarios like where you're dealing the case, you're in the OPD. So yes, in the beginning you can itself say, after asking
yes,
concerns that I will be giving the written information leaflets. If the GP letter is there, you can in the in very beginning you can say that I'll write back to GP as well. So communication with colleague, one box is ticked, finished.
correct.
Yeah, you
Yes,
don't have
ma'am,
to
correct.
wait till the end.
Yes.
Mm-hmm.
Then the patient safety, you said the smoking and all. Then and there, I said the smoking is, if I find smoking, then and there, I will refer you to NHS stop smoking. Then, if the patient is of a heavy weight, then I said you have to reduce your weight. In one station, the patient was very angry. I came for other complaint. Then why are you telling me about the weight? I said,
Okay. Yes.
the increased weight will cause many other problems later on. So for your general health, I'm improving like that. Then she kept quiet.
Mm-hmm. Yes, yes, you have to deal with the angry patients also. In
Yes,
those scenarios, you just have to listen to her and let her
yes,
vent out her anger or whatever she wants to say. And
yes,
then you are going to pacify her and explain.
yes.
Yes. Mm-hmm.
Then the other plus point in your course is the labor ward prioritization, madam. You put all the recalls together. That is a very good plus point. I can say that
Yes.
because now
Mm-hmm.
the labor ward prioritization
Thank you.
session was cakewalk for me, ma'am.
Yeah.
You put everything together, and then we were discussing that time. That day was very hard for us, but when I came, when the in the exam, no, everything we discussed came, ma'am. Like
Yes.
BMI
Mhm.
40, and then with labor that is that she has delivered with BMI 40, like all which we have discussed came.
Yes. And preeclampsia case also, I think, and PPH case.
Yes,
Yes.
yes, ma'am. Exactly. The
Preterm
IUD we
labor.
discussed with you said IUD. You always you to should rule out abruption. Then
Mhm. Yes.
because only IUD was given, there was no blood pressure. Then I asked for the blood pressure. The blood pressure was very high. Then I said,
Exactly.
This is the top priority for me." Like that, I said,
Yes, yes, because nowadays no information is given there. Only the
"Yes, madam.
patient and just little bit of clinical information is there.
Yes,
Observations will be missing completely. So you have to ask about how the patient is doing, what about her vital signs, is she stable,
yes,
any pain and contractions, everything you have to ask. And
yes."
then the examiner is going to give you the informations.
And the other thing is, you were keep on saying practice that the second stage is cesarean section. I just
Yeah.
studied after you said only I studied that
Mhm.
stage. Some in because I was searching that scientific impact paper, ma'am. It
Yes.
was written declined something. So I thought
Okay.
of I was thinking of now leaving that. Then I thought, oh, you were repeatedly telling, so let me
Mhm.
study that.
Anything new is going to be there in the exam.
Yes,
Something
ma'am.
new from the talk scenario, any new
Yes,
scientific impact paper, new
yes,
guideline,
ma'am.
anything.
I studied
Will be
that
there. Will be there.
thoroughly. I don't know why you were repeatedly saying that was very important. It may come, it may come. So I
Yes.
was studied. I studied that, and it was one of the structured discussion, ma'am. To my
Mhm.
surprise.
Yes, yes, it was a long, I mean, of course, structured discussion task. Until and unless you don't know about the topic, it's very difficult to deal with the
Yes,
structured discussion
madam. Yes,
task.
she asked in and out of everything. She first, it was
Yes.
started like whether you wanted to put forceps or vacuum. Then she suddenly she went inside that chapter. It is a
Okay.
deeply impacted head. Now what are
Mhm.
you going to do? With forceps, she is not delivering. Then what are you going to do
Right.
like that? Then I just remembered everything. That second
Second
stage
stage
cesarean
cesarean
section.
section. Okay.
Yeah. Then I said the footstool I'll
Mhm.
make the anesthetist to give relaxant. It is a
Yeah,
teamwork. One midwife should stand on the foot end and she has to push the head. And then after that, I have to look for the injuries. I make my consultant come and see whether the was any injuries are there like that.
right.
I said
Yes, yes.
that station. If if you are not insisting, I would have not studied that station, ma'am. Yeah.
Exactly. Yes, because we know anything new, like it will be there. I mean,
Yes.
nearly nine scenarios are recalls. It is not that
Yes,
they are
ma'am.
straightforward recalls. There is going to be some
Correct, ma'am.
twist.
Yes, ma'am. Correct.
But four, five stations will be new. Something from the talk, scientific impact paper, green top guideline, nice guideline. They have so many things. So
Yes.
yes, it all in every exam there is something new.
Yes, madam. Yes, madam. Then that the diabetes actually we discussed, I think that only came for me. Like
Hmm.
increased blood sugar
Yes,
with hemoglobin A1C was very high and she is 9 weeks.
yes.
So You said you were teaching in the class that we have to ask why the sugar was high. Then I was asking why the sugar was high, whether you are able to not it,
Mhm.
what happened, why you are not putting the insulin properly. Like that, I asked the examiner. Actually, the role player was very
Mhm.
cooperative, and she was saying that had some monitor and all, and the
Yes.
midwife was not aware of the monitors. Like that, she said. Then I said, then in that case, you have to get admitted so that we
Mm.
will be aware of that monitor, and we have to check whether it works properly. Like that, I said. Yeah.
Mhm. Exactly. Yes.
Yes, ma'am.
So
Because
maternal
the course
medicine
was
is
very helpful,
also,
ma'am. For me, it was very, very helpful.
I'm so
Every station I
happy
remembered
for
you
you.
only.
I'm
Yeah,
so
ma'am.
happy for you.
Yes,
Yes.
ma'am.
Actually, exam was a bit tough this time because
Yes,
of
ma'am.
few stations. But yes, like,
Whatever station I know, no, I did it well. So I passed, I think.
yes, yes. You have to be very calm whenever you see any news station. And because passing in information gathering, communication with colleagues is easy.
Yes, ma'am.
Difficulty arises in patient safety and applied clinical knowledge. So
Clinical
for that,
knowledge.
you have to be thorough with
Yeah.
the guidelines. I mean, the management part and all. Yes, you have to keep revising.
And then you have added the radical trachelectomy as well. I think in the last in the oncology
Yes.
station you added that. I studied that and went, why madam is adding this? Is this
Mhm.
important like that? Then I just went through the cancer guidelines, madam. It was given in a one big paragraph. I just mugged up everything.
Mhm. Okay.
just just like that in the exam, no, they were asking, she was asking that only. So what will you do
Right.
for me? I
Mhm.
wanted a baby. Then
Yes.
I said, we will remove the neck of the womb alone and I will put a stitch, they will put a stitch, and the MDT will discuss, and then you have to do cesarean afterwards, like that.
Yeah. Right.
Then she was asking me what other thing you will do, what other thing. Then I said, they sometimes they may remove the womb, and you may can
Mhm.
go for surrogacy also. That is also an option. So that means what are the advantage and disadvantage? She asked. Yeah.
Yes. Exactly. Yes. 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 So,
Then the other, yeah,
mhm. Yeah.
fertility, everything, whatever we discussed only, ma'am. And then fertility station was unexplained fertility, 42 years, I think. She
Mm-hmm.
was ovulating as well as the sperm count was normal, and then she was looking forward for a baby. I said that you are ovulating and the husband also sperm count also normal means it is unexplained, and you should go for a donor oocyte since your age is more. Yeah.
Okay. Mm-hmm. Right. That was patient was asking about like her fertility options and all. So yeah, you
Yes,
have to
ma'am.
discuss
Yes,
about
ma'am.
egg donation and everything. Exactly.
Yes,
So
ma'am.
finally,
Yes, ma'am. I
you are
clear. I
MRCOGN. You
Yes.
are a,
Yesterday I slept well, ma'am, after so many years.
oh my goodness. So
My mom was like, I'm 47 now. My mom was crying from there, and from India she was crying seeing me.
yes, yes, yes. It
Yeah.
was a very difficult time for you. I mean,
Yes,
with
ma'am.
so many things, because we are
Yeah.
preoccupied with a lot of other things,
Correct.
plus this
Yes,
exam.
ma'am.
And you
Correct, ma'am.
have family, you're not alone in this journey.
Yeah, we
Many
cannot
people are involved with
concentrate
you.
on family life as well. We are not passing here also. What to do? I don't know.
Yes, yes,
Like
yes.
exactly.
I am elated, when you called, like when we
Yeah,
had
ma'am.
this talk, I was so happy for
Yeah.
you. And
Yeah.
like when you were calling me, I was, it was, I knew it was, it's going to be positive news from your side.
Yeah.
Waiting for you to hear from you, actually.
Yeah.
I
I
was
was very
waiting
happy. Yeah. The same thing happened when I passed part two. No, I was studying with Zayab, ma'am. The
Mhm.
Zayab Qureshi, I saw her when I was doing my first time part three. I just cried at her.
Okay.
Like, I
Yes.
just followed whatever group, no, she will say this to study this. Then I will religiously follow that. The same way I followed your course also.
Yes.
Whatever you say, I religiously followed her. She's saying this, oh, okay, this may be important. We'll study that like that.
Yes,
Yeah.
yeah, yeah. Yes, actually for me also, like I'm trying to like either include nearly all the important scenarios in the course, but sometimes, we it takes time actually. Sometimes it
Yes.
really takes time.
Very
So
hard
I
work,
I
ma'am. I know
always
that
say
it. Yeah,
that
it's very
this
much
is
of
going
hard
to be
work on
your
your part also. We
this
are
will be
putting
your
hard work,
work.
yeah,
Yes.
but
Yeah,
it
yeah.
has to be channelized like well, like so with some mentorship, ma'am. Then only this is very easy to crack. Otherwise, it's very difficult.
Yes, because you know you need a platform where you can practice stations where you can speak, and someone has to be there to give you honest and sincere feedback.
Yes,
Yeah, at the same time, not undermining, of course, because we are all colleagues. All of us
yes,
are doctors. We are all like at the same level.
yes,
So, like that respect also has to be there. Okay.
yes, ma'am.
So,
Exactly, ma'am.
anything else you want to add? Any more precious tips?
I think whatever I have in my
Yes.
mind, I mentioned you. Yes, ma'am.
Okay. Okay, Dr. Shanti, it was really nice to have you here, and thanks for giving your precious time. Thanks for joining the session.
Thank you,
So,
ma'am. Thank you so much,
okay.
ma'am. I am very, very grateful to you. And yeah,
Yeah,
ma'am.
I'm very, very happy for you. And once again, heartiest
Yeah.
congratulations to
Thank you,
your
ma'am.
family and to
Thank you, ma'am.
everyone. Okay, my
Yeah.
dear, all the
Yeah.
best and
Thank you, ma'am.
wishing you very best in all your future endeavors.
Thank you, ma'am. Please keep in touch, ma'am.
Yes, sure. You also. Okay.
Yes, ma'am.
Yes,
Definitely.
Dr.
Thank you, ma'am.
Shanti. Okay, my
Yeah.
dear. Thank you so much.
Bye, bye. Bye,
Bye-bye.
ma'am.
Bye.